Alright everyone, welcome to the video about the trauma assessment for a patient that's victim of a gunshot wound. We'll go ahead and get a little dispatch here.
So you get dispatched to a local park for a 20-something-year-old male who got shot. PD's at scene, they've secured the scene.
Alright, I'll take my standard precautions to ensure that the scene is safe.
Scene safe.
It appears I have one patient based off dispatch. It sounds like a mechanism of injury, not a nature of illness. I'll have my partner hold and maintain manual inline stabilization, and I will consider the need for additional resources. Walking up, forming a general impression of my patient, what do I see?
You've got a 20-something-year-old male clutching at his right chest saying that he got shot.
Okay, I'll expose the area. What do I see?
You notice a penetrating injury, looks to be like a sucking chest wound.
I will cover that with a gloved hand while I instruct my partner to get me a 3-sided occlusive dressing or a hyphen chest seal. And I will instruct them to place that on the injury. On exhalation, a little bit of gauze in here. We'll wipe off any of the blood or surfactant coming out of there, and we'll apply this chest seal with the wound centered on the center of the chest seal on exhalation. I will also, at this time, this is being held in place, check for any exit wounds. Do I find any exit wounds?
None noted.
Okay. Going back up to the AVPU, is my patient alert? Is he looking at me?
He's alert and tracking you.
Okay, I will go through the orientation questions. Sir, what is your name?
Greg?
Greg, what city are we in?
We're in San Diego.
What year is it?
2020.
And what happened?
I was walking through the park and I got shot.
Okay, so my patient is ANO times 4. Besides the obvious penetrating injury to the right anterior chest, do I see any other life threats?
You do not.
Okay, his airway's patent because he is speaking to me. We do not need any adjuncts at this time. I'm looking at his rate and tidal volume. What do I see?
Breathing about 22 times a minute, full and effective, adequate tidal volume with mild respiratory distress.
Okay, considering the mechanism of injury, we will apply a non-rebreather mask at 15 liters a minute. I've got my O2 tank here. I will turn that on. My non-rebreather mask. I'll plug that into the tree. Turn this up to 15. And I'll have my partner get a baseline O2 saturation. What's that read at?
Patient's satting at 88% on room air.
Okay, so we got 88% O2 saturation on room air. We'll see if we can increase that with the non-rebreather mask. Are there any other injuries that can compromise ventilation?
Not that you know.
Okay, going through circulation, I'm going to check a pulse at the radial and the carotid site.
You've got a strong and rapid carotid with a weak and rapid radial.
Okay, skin signs.
Pale, cool, diaphoretic.
I'll perform a hands-on blood sweep from the head of my patient down to the toes, checking for any bleeding.
You note blood at the chest.
On the chest?
Mm-hmm.
Okay, is there another injury?
Nope, just controlled from the chest seal.
Okay, checking each arm. Do I note any bleeding to the left arm?
Not yet.
To the right arm?
Nope.
Down each leg?
Clear. Good.
And on the posterior section of the thorax, I didn't see anything there, did I?
Nothing that you noted.
Okay. I will place this patient in the supine position to treat for shock. So at this time, we'd actually put the patient on the gurney. We'd lay the head of the gurney actually to about 30 degrees, considering his mechanism of injury here, that penetrating trauma to the chest. We don't actually want to lay him fully supine, even though we're treating for shock, so we'll keep the head of the bed at 30 degrees, and we'll put a blanket over him, keep the ambulance up to 85 degrees, and prepare for rapid transport. I'll calculate a GCS at this time. His eyes are tracking me, so that's a 4 for eyes. He was responding appropriately to my questions, but I will verify and ask those questions again. So, sir, what's your name?
Greg?
Greg, what city are we in?
San Diego.
What year is it?
2020.
And what happened to you today?
Still got shot.
Okay, so he's got a 5 for verbal. He's still responding appropriately. Let's see if he can follow simple motor commands. Sir, can you raise your left hand?
He's able to.
Okay, so he's got a 6 for motor, a total of 15 on the GCS, but considering that mechanism of injury, we'll transport to the closest trauma center as rapidly as possible.